So you might be well aware of that despite the clinical implications, the immune microenvironment of breast cancer and of brain metastasis in particular is still quite poorly understood. So we have little data on that, despite the fact that we are currently using immunotherapy, at least for triple-negative breast cancer patients. So we use a technique in the study, which is multiplex immunofluorescence, which allows to visualize simultaneously on the same slide different biomarkers. So in this way, we could analyze a large number of immune biomarkers on the same slide and at the same time analyze them spatially. So analyze if they were in the stroma or in the tumor area, for example. So we collected 60 samples of breast cancer brain metastases across 3 centers, the Instituto Oncologico Veneto in Padova, Italy, where I'm from, the Instituto Cancer de Montpellier in France, and the Montefiore Institute in New York. And we analyzed them using a panel which was centered to include immune checkpoints and co-inhibitory molecules. So it included the CD3, PD1, PD-L1, TIM3, LAG3, and CD163, which in fact is a marker for macrophages with a M2 profile, and keratin for tumor recognition. So what we observed with this panel is in fact that the only immune biomarker among the ones I said before, which was associated with a different prognosis of these patients with breast cancer brain metastasis, was a higher density of M2 macrophage polarization. So a higher density of CD163 positive cells, both in the total sample area, in the tumor area, and in the stromal area, was significantly associated with worse overall survival. And this was true across different subtypes. So in hormone receptor positive and hormone receptor negative, HER2 negative patients. And this is very interesting because we might act on this biomarker through diverting, in fact, macrophage polarization. There are some studies, for example, in some preclinical data that we might use PIK3CA inhibitors, PI3K inhibitors such as buparlisib to in fact divert macrophages towards an M1 profile. And this in fact is very interesting as we now have some new PI3K inhibitors which are under study, which also cross the blood-brain barrier, and so they would be good candidates to test this hypothesis in the clinic. And we also identified that there were some components which were differently present across breast cancer subtypes. So stromal TIM3 positive cells were more frequently present. There was a higher density of stromal TIM3 positive cells in hormone receptor positive HER2 negative breast cancer brain metastasis. And this was associated with better prognosis in this breast cancer subtype. So we don't exactly know why this is the case, but it's something which should take into consideration, especially as TIM3 inhibitors are currently being tested in clinical trials as well. This study was quite a small study, which included 60 patients, which is a large number for having biological material for breast cancer brain metastasis, but from a numerical point of view, subtypes were quite small. So as a first step, I think our results warrant for validation in larger studies. And in fact, they might give some hypotheses to work with to, for example, decide to include some breast cancer patients with brain metastasis in the clinical trials which are developing these drugs, which might have some biological rationale to be further studied in these patients.